Welcome to the Diabetes Podcast, where we rewrite the story of diabetes. If you're ready to break free from the guilt, the medication, and the fear of complications, you're in the right place. Each episode is packed with real talk, proven strategies, and inspiring wins from people just like you. Yes, remission from type 2 and prediabetes is real, and it starts right now. Let's get into it. All right. Welcome to the Diabetes Podcast. I'm Richie.
And I'm Amber.
And this is actually a continuation of last week's conversation about increased insulin resistance in the muscles. So we are going to pick it up. We're going to get right into what are the medications used to treat increased insulin resistance in the muscles.
That would be the class biguanides, which would be metformin, would be the most commonly heard of. Metformin, glucophage, that's the one that most people would notice.
Okay.
Or that everybody tends to, I don't want to say everybody, most people understand metformin when you say it. I won't say understand. Most people recognize the name metformin.
I recognize metformin.
Yeah, the first line of defense is diet and exercise. If you look at the algorithm recommended by the Association of Clinical Endocrinologists, diet and exercise is the blanket that's supposed to come first. That's supposed to be your first line of defense. And then metformin.
So just so I'm clear, my physician should have probably said not once and not twice, but probably
not three times.
Probably a great many times. I should have heard something along the lines of, you might want to lose some weight and you might want to exercise more and you might want to maybe look at what you're eating. Is that right?
Yes, and I don't...
Hey, I'm writing you a script for metformin should not come out of nowhere, right? There's been a trend, should, in a big air quote,
yeah,
should.
I hate that word, by the way.
But if, based off of the algorithm for treatment of type 2 diabetes, the prescription of metformin is not my first line of defense. There ideally has been not one, but probably many conversations, because this is up to 20 years. That just boggles my mind that there's this incredibly long, very slow downward trend until it starts to get to be a medical problem. It's an inconvenience maybe, but this is not, I woke up one day and I had prediabetes or diabetes. This has been in the mail for a bit. Is that right?
Yeah, that's absolutely right. And what's interesting about that is many people do feel like prediabetes or diabetes comes out of left field for them. I say that, yet when they really think about it, when they really look at how much they've been moving, what they've been eating, the amount of stress that they've been under, then people are like, oh yeah, that makes sense. And yeah, it has been longer than I thought, but it still doesn't stop that diagnosis from hitting people like a Mack truck. People are incredibly surprised by it most of the time. And I think what's really missing from that equation is this idea that this has to be a lifestyle change and resources have to be given to people. You cannot just say, eat better, move more, because the truth is people in a survey said they'd find it easier to do their own taxes than to know how to eat healthy and move appropriately.
Okay. So who does that?
A few people, but I would say the overwhelming majority they're not exercise physiologists. They're not registered and licensed dietitians. They're not certified diabetes care and education specialists. So it's not for lack of wanting to help patients. It's just that a lot of that education and skill is somewhat lacking. And if the education and skill is absolutely there, then you also have a time factor with that next patient that they're already 15 plus behind.
I need you to change a lot of the things you've been doing for the past 20 years. Let's knock it out in the next 20 minutes. Yeah.
Exactly.
Yeah.
Exactly. And that's a whole other podcast as well.
Yeah, we keep saying that.
We keep saying that.
Yeah.
Yes. So that class of medications that is then recommended once you come in and you have diabetes, or even if your doctor is more proactive and you have prediabetes, they will often prescribe metformin, these biguanides, because they are insulin sensitizers. They work in some of the same ways as activity.
Okay. So can you speak a little bit to, there has to be some good that these medications are doing. What's metformin doing in my body?
If you would read some of the papers, you would think it was a miracle drug. And in fact, in the diabetes prevention program, that was a randomized control trial with more than 3,000 people in it with impaired glucose tolerance. So impaired glucose tolerance, like insulin resistance, is prior to impaired glucose tolerance. Impaired glucose tolerance can show up later, after the high insulin levels, after insulin resistance. Then you show this impaired glucose tolerance. And metformin decreased the incidence of type 2 diabetes by 31% compared to placebo.
Okay. So that's not insignificant.
No, it's not insignificant because it just helps on some of the same pathways that exercise can help on. So the biggest thing that people can do is to help with kind of this metabolic storm that's going on is to put the manager back in charge. But I'm getting ahead of myself because I think you wanted to talk more about metformin before we move forward, because it's not all sunshine and rainbows.
Okay. Let's talk to what isn't sunshine and rainbows about metformin. Honestly, at this point in time, even with my limited experience, I feel like I could speak to the not sunshine and rainbows because I've heard it so many times from so many people.
Oh, what have you heard? Just out of curiosity.
I'm just going to, it's diarrhea. Like that really is the big one. Almost uniform complaints about diarrhea at incredibly inopportune times. Almost uniformly.
Is diarrhea ever occur at an opportune? Oh, this is a good time for me to have diarrhea.
But I don't think they speak to that particular side effect. They talk about nausea. They talk about diarrhea. They don't talk about inopportune diarrhea, which to me is worse than just regular diarrhea. Inopportune diarrhea to me says, I can't be that far from a toilet, right? Like this is going to affect my work. This is going to affect me going to the grocery store to get stuff. The incredibly inopportune diarrhea is a lifestyle changer. I can't say it any better than that. I start to behave differently because I'm on this medication. Not that I'm psychologically affected. I literally have to start planning how far from a toilet am I going to be? Yep. Where's the nearest can throughout the day? I have to know that. The second I walk through the door, where's the bathroom? Because this can come really at any time.
Yeah. And I think you can't say that there's no psychological effect because everything you just described has a psychological
effect. It's not the medication specifically affecting my brain chemistry. It's my brain chemistry is being affected due to my circumstances.
Absolutely.
I'm with you.
Absolutely. And some people go on metformin and they have no side effects whatsoever. They are fine. Their A1Cs and blood sugars come down really well with the medicine. And on the other hand, people can have horrible diarrhea and hate the medicine. And it can depend on the factors in which the person was prescribed metformin. So if your physician started on a low dose, like 500 milligrams, that's what you want to do. You want to do 500 milligrams. And then maybe after 2 weeks or so, go up to 1,000 milligrams and 1,500. And then the maximum dose of metformin is considered 2,000 milligrams. So usually 1,000 milligrams in the morning, or like maybe 1,000 milligrams with breakfast and 1,000 milligrams with the supper meal. And also, there are extended release versions of this that can help people not have diarrhea. Where I've seen it really go awry is when you have somebody newly diagnosed and their sugars are incredibly high. Wow. They're understandably resistant to taking insulin or any kind of shot. And so they're put on the maximum dose of metformin from the word go. And that is disaster. And it's even more disastrous because they get diarrhea, glued to the toilet, they stop taking it, they think that doctor's trying to kill me. I can't get off the toilet. And then they don't go back. And denial comes into play in a big way. This can't be happening. I can't take a medicine. It's going to keep me glued to the toilet. It's just, it can go many different ways with this.
Okay.
So the main goal, as we always say, to prevent that side effect, you can do some things.
Yeah.
So this is the fun part. This is
Yeah.
where we get into the anything meds can do, you can do better piece. So the goal is to put that insulin manager back in charge, decrease that resistance. You've got all these people protesting outside, and we want to get the insulin back in charge of all of this. And the way that you can do that is to move your muscles often. Remember when I was talking about the diabetes prevention program and metformin decreasing the incidence of type 2 diabetes by 31%? Lifestyle intervention, which is diet and exercise, was more effective, reducing the incidence of type 2 diabetes by 58%.
Hold on. Let me just do some quick math here. Say those numbers again.
58% reduction in the incidence of type 2 diabetes with lifestyle intervention versus 31% with metformin.
I'm sorry, this is mind-boggling for me. I could take a medicine that has 31% effectiveness, which also has, let's just call it a coin flip, a decent chance of disaster pants. Or I could walk for somewhere between 2 and up to 30 minutes after my meal. And in my experience, a very low chance of diarrhea. And that second solution would be almost twice as effective.
Oh, you're hurting people's ears, but yeah.
As the one with the, to me, unacceptably high chance of crapping my pants.
Yep.
Okay. I just wanted to make sure I understood.
Because when you move those muscles, especially after meals, just 2 to 5 minutes, you can help lower the post-meal blood sugar spikes and decrease the triglyceride surge that the liver can put out.
Okay. I think it's important to clarify. We talk about moving the muscles. Is it just walking, or is there something else that I should be doing?
Should, that word.
Yeah.
You know, you have to start somewhere. If you are sedentary and do not have a regular practice of movement, then a great start would be 2 minutes after every meal and getting in that habit. Maybe you find your biggest meal and you walk 2 minutes and you do that for 5 or 6 days.
Yeah.
Then you find your next biggest meal and you walk 2 minutes after 2 of your, like, you just keep stacking those habits.
Building on that.
Big props to James Clear for that. And you stack that on top of something that you're already doing. Like, you're already eating, so get your shoes by the table, go. Or walk barefoot in your house. It's 2 minutes.
Yeah.
Don't give me the excuse about the weather and it's cold and that. You can walk 2 minutes in your house.
But I can accomplish the reduction in blood glucose through walking. Is that
absolutely?
That's okay.
And you also can want to clear fat from the liver. So fatty liver, non-alcoholic fatty liver disease also goes hand in hand with type 2 diabetes. And the way you can help clear fat from the liver is very nutrient dense. So nutrient density, we can have a whole podcast on that, but it's basically getting more bang for your buck in terms of your calories. If you have 100 calories of beans, that's not the same as 100 calories of jelly beans. So you're getting...
Oh, man.
I know. Sorry to break it to you.
Dang it.
I know. I know. And you want a really fiber-rich eating style. And something to stop is those refined sugars. You want to stop that constant influx of refined sugar, this refined sugar flood.
What's an example of a refined sugar?
That would be your white bread. Refining means it has had the process of stripping that wheat husk, stripping the wheat germ off, and that's how you get more palatable, softer foods. So a lot of food science back in the day was geared to increasing the palatability, the chewiness, because
Mm-hmm.
people really enjoy chewy, soft foods. But that's
Right.
horrible for so many different reasons. And that's another podcast.
Yeah. Yeah.
But yeah, it's your sugary drinks. And this is also why some doctors would say eliminate all white foods, which is also a problematic, can be a problematic.
I've heard that too. Is that real? Is that a thing?
It's definitely a thing. I don't know if it's an effective
Hmm.
thing. It is a start when you have just 2 minutes. If you have a 30-second spiel on what you need to tell your patient to do, eliminate everything white. It's just super easy. Is it as effective as it needs to be? No. Onions are white and they're great. White peaches, garlic, really wonderful things can be, well, I love garlic.
Yeah.
Really wonderful things can be white. When you do strip the bran, it goes from brown to white. So that's where that sugar is white. That's where that started from.
Is it safe to say foods that require more chewing are probably better? Is that accurate?
As a general, like if I were to give you that same advice, don't eat anything white, I might say.
Well, okay. So
I'd say
for
that.
example, like I've made some mistakes. I've been to Krispy Kreme more than once. That light comes on outside, and I can tell you right now, when it's hot donuts now, I don't have to chew those donuts. I can put the donut in my
You know,
mouth.
you're telling on yourself very
Well,
much right now.
it's fair.
Okay.
We all make mistakes.
I too have had my
But I don't-
Krispy Kreme experience.
I don't
before.
have
Yeah.
to chew that donut. I mean, it's almost pure refined sugar
yeah.
and pure refined
That is
flour, I guess.
definitely-
And just the saliva or in my mouth is enough to pretty much dissolve that donut versus like a whole wheat bran muffin. It's coming from the same place, but there's a lot more chewing involved. Fibrous vegetables, they're not melting in my mouth. There's going to be some chewing involved in that. I guess that's what I'm
Yeah,
getting
like
at.
beans would have more resistant starch. They have more fiber. They help slow down the release of food from your stomach, and they slow that post-meal blood sugar spike.
I guess when I'm talking about refined sugar and refined flour, in my mind, like they're almost identical. It's white powder. if the base of the food that I'm eating is a powder, it's been refined, right? I had some water, I had some oil, maybe some eggs or whatever to that thing, but still at some point in time, it was powder, right? Is it that's
Now we're getting in the weeds. This is
Okay.
the definition of getting in the weeds, because you do have powdered protein.
Right.
You do have powdered eggs. It's just dehydration. So that's more of a function of processing, and not all processing is bad. We're talking about these ultra processed. So you are very correct in very many ways, but it's also not something that you can absolutely take and run away with.
So scratch the powder. Really what we're talking about is ultra processed sugars. Because whether it's coming from a flour of a carbohydrate base or
Cakes,
a refined
cakes,
sugar,
cupcakes,
the-
sugary
those
Coke,
powdered
sodas.
carbs, for lack of a better
Yeah.
description, are gonna affect me worse than something I gotta work a little bit at. Okay.
We're talking about your vegetables, your green, lean protein, healthy fats. Those are the type of things that are more
what would
nutrient
healthy
dense.
fats be?
Those would be your monounsaturated fats, some polyunsaturated, your omega-3 fats. Those are your healthy fats.
So bacon's not on there?
Bacon's not on there anyway, but
Man.
anyway, your liver, as long as it's not scarred, your liver has an amazing ability to regenerate, and it can do this within weeks of an eating change. So fat can clear from the liver, which increases those high density lipoproteins, decreases triglycerides, increases the size of the LDL. So no longer is it that very low density LDL. It makes them way less dangerous by fluffing up the LDLs. And then you can decrease visceral fat by decreasing processed foods. So that's back to where those ultra processed foods, managing stress and sleep, building up muscle, and staying consistent. When you shrink that visceral fat, you're really stopping that snowball toxic chemical troublemaker. and quiet the fire inside and around your internal organs. So that's how you can really help reduce insulin resistance, like actionable steps.
Okay. This has been very educational for me.
I'm glad. I hope it was
educational.
I hope it was very educational for you. I learned to did something today.
Yeah. We all learned something.
Fixing to learn.
But this to me is really encouraging because I can't tell you how many times people want to switch. Just I want a quick something.
Fix.
And
make it better.
Really,
Give me a pill.
that movement piece after the eating, that is it, man. That is a switch. I turn that on and blood sugar drops right back down. And
not necessarily right back down, but it's going to improve whatever situation is going on.
But even 2 minutes is meaningful. In my mind, like nothing else that we're talking about is, hey, you're going to be better in 2 minutes. Like we're saying, literally, you'll be better in 2 minutes. This is as close to a get into my cells blood sugar as we have.
Absolutely.
Right? Completely outside of medication, completely outside of an injection of insulin. This is, I make my body soak up the sugar.
Absolutely. That muscle contraction moves that GLUT4 up to the surface of the muscle cell, and it's a channel that lets the glucose get into the cell in the absence of insulin. Yes.
Yeah. Great.
Yep. What are we doing next time?
Next time, we are talking about, oh man, we're back to another thing I don't know anything about. We're talking about lipolysis. Did I say that right?
We're talking about the increase of lipolysis. So going back and revisiting that increase of free fatty acids. And this also can decrease over time beta cell production. So it's causing a beta cell dysfunction, which is how you would eventually not have enough insulin and require exogenous or require a shot of insulin.
So we're all going to get more education next week.
We sure are.
Okay.
We're going to learn now.
All right. Well, this has been awesome. And until next time, I'm Richie.
And I'm Amber. And I really hope that you can take something away. It's one thing to listen. It is a completely different thing to take one thing that you learned. Can we think of one thing that we've learned here? I think it's moving after you eat, creating new habits around that. And we will see you on the next Diabetes Podcast. Take care of yourself.
Thanks for tuning in to the Diabetes Podcast, where diabetes doesn't define your future. If you liked what you heard, please share this episode and leave a review. If you want to hear more, please subscribe to hear the latest episodes. And if you're ready to take the next step towards freedom and energy, head to empowerdiabetes.com to learn how we support real change with real results. Your healthiest chapter starts now. Take courage. You can do this, and we can help.